Hello, everyone, and thank you for joining us. I'm Janice, an account manager at the Washington State Healthcare Authority, and this is Brian, a VEBA plan representative from Gallagher, or VEBA MEP administrator. When you retire as a state agency or higher education PEP employee, you may be able to participate in the VEBA MEP. Just what is this plan and how does it work? Brian is here to help you get the answers you need. Welcome, Brian, and thank you for being here.
Thank you for having me.
So can you tell us a little bit about yourself and what the VEBA MEP is?
I've been working with public employers and employees for the past 20 years, helping navigate the costs of healthcare after retirement. The PEP program offers the VEBA Medical Expense Plan, or VEBA MEP, for retirees from state agencies and higher education institutions. The VEBA MEP is a health reimbursement arrangement, or HRA. However, to keep things simpler, we'll just use the term VEBA MEP. A VEBA MEP is basically a tax-free savings account for healthcare expenses like premiums or copays. It can help with out-of-pocket healthcare costs. If your employer offers VEBA MEP, when you retire, your employer cashes out your unused sick leave and converts that in tax-free to a tax-free contribution. You choose how you want to invest your funds using an available investment fund lineup. Depending on your needs, you can start to use your funds right away or save them for later. The money is yours to spend when you need it.
So when can someone enroll in a VEBA MEP?
This benefit is only for when you retire. IRS rules don't allow you to contribute to a VEBA MEP account on your own. It's on a group rather than individual basis. There are two ways a group may decide to participate in VEBA MEP. One way is for an employer to allow employees nearing retirement to vote on whether unused sick leave will be placed into a VEBA MEP. The other is for a labor union to bargain for VEBA MEP. To find out if your employer offers VEBA MEP, you should contact your employer's benefits or payroll office.
Can someone make contributions to an account while they're still working?
The only way to contribute to a VEBA MEP is to deposit your sick leave upon retirement. However, if you are a school employee or working for a city, county, or special purpose district, there may be other options while you're still an employee. To find out if you can contribute to VEBA as an active employee, you should contact your employer's benefits or payroll office.
And can you explain how it works when you cash out the sick leave?
Yeah, let's use a state employee, Jack, as an example. So Jack is about to retire and is eligible for a 25% cash out of his unused sick leave hours. He has 1,000 hours of sick leave, so he will end up getting paid 250 hours. His rate of pay is $40 per hour, which comes to $10,000. After taxes, Jack can expect to have about $7,000 left. With the VEBA MEP, Jack keeps the whole $10,000 tax-free.
So VEBA MEP funds are not taxed?
That's correct. All contributions, investment earnings, and withdrawals are tax-free. There's zero income tax and zero payroll taxes. With a $10,000 contribution like Jack's, that's around $3,000 in tax savings.
Do you have to use the money before a certain time?
No, the funds can be used at any time after you retire. There's no expiration date on using the money.
And who can use these funds?
You can use the funds for you, your spouse, and other qualified dependents up to age 26. State-registered domestic partners may be eligible if they meet the federal definition of qualifying relative.
How can someone use the funds? Do they have to file a claim, or is there a debit card?
There are a lot of ways to use the account. I think the easiest way is to set up an automatic premium reimbursement for ongoing insurance premiums. You pay the premiums yourself, maybe out of your pension check or bank account, and you can set up VEBA MEP to automatically reimburse yourself for all or a portion of that monthly premium. You can also submit claims online or through the mobile app. If you submit a claim, you would need to provide proper documentation such as an explanation of benefits from your insurance company or itemized invoice from your provider. Finally, yes, there is a debit card. This works great for paying for things like copays, prescriptions, over-the-counter medications, lab work, or hospital stays.
A question we sometimes hear is, why would someone want to enroll in a VEBA instead of taking the sick leave cash out at retirement?
The short answer is tax savings. Sick leave is cashed out at 25% regardless of whether the funds are deposited in a VEBA MEP. With VEBA MEP, a retiring employee can save around 30% by not paying any income or payroll taxes. When you consider the cost of healthcare in retirement, even if you retire and go straight on to Medicare, it's estimated you would end up spending close to $100,000 on your retiree premiums. Anything you can do to help your dollars go further can definitely help.
We've covered a lot today. What would you say is the most important takeaway for someone?
I would say the most important thing to remember is that VEBA MEP is a tax-free account with triple tax savings. You do not owe taxes on your contributions, your investment earnings with those funds, or withdrawals for medical expenses. So why not cover those expenses with tax-free money?
Okay, Brian, last question. Where can people go for more information?
We focused on the VEBA MEP for state agency and higher education employees. They can find more information at VEBA.org. If you work for a city, county, or special purpose district, you would go to HRAVEBA.org. I would like to add that PEB and SEB members can also speak with their benefits or payroll office for more information and to inquire if this is a benefit their workplace currently offers.
I sure have learned a lot today. Thank you so much for your time today, Brian.
Thanks for having me, Janice.
And to all of our viewers, thank you for watching today. Thank you for your public service, and be well.